Okay, welcome to Module 8. Alright, see how cool that is? And we're going to see how this works. Hopefully it will work pretty well. And let's just kind of move on and see what happens. Okay, in this mod, we are going to be talking about the following things that all have to do with like headache and dizziness, okay? So, trigeminal neuralgia actually, kind of a stretch about headache or dizziness, really. What it really is your fifth cranial nerve, your cranial nerve number 5, is really messed up. And it burns and catches, it's really tough. Anyway, we'll get into that. That is more of a face, kind of really excruciating pain. Okay, headaches, migraines, we'll talk about the headaches and the migraines, the different kinds of cluster headaches, the tension headaches, the migraine headaches, sinus headaches, that sort of thing. And then we'll move on to meningitis and encephalitis. Okay, the inflammation of is always itis, of course. The meninges, or your 3 layers of your pia mater, your arachnoid matter, and your dura mater. And then we'll look at encephalitis, which is your inflammation of your entire brain itself. Okay, moving on to temporal arteritis. There is a pretty cool video that we'll try to show. It won't be part of this video thing. I think we'll just make a link on the regular part of the PowerPoint. But you have temporal arteritis, epidural and subdural hematoma, as in where it is bleeding from, and 3 kinds of subdural hematomas. Okay, and all of these, of course, they're going to increase your intracranial pressure, as in inside your head. You're going to increase pressure with these hematomas, or these bleeding into the brains, and not that you have brains, but the brain. And of course, they're usually caused by brain injury, and they cause more brain injury as they press on the brain from the bleeding. Anyway, papilledema, we'll look at that specifically and what it has to do with headaches. Aneurysm, okay, a review on aneurysm. We've already seen that before, so we'll look at that again. Pituitary adenoma is a pretty cool one, where you have like 3 different kinds of hormones that, well, you have a bunch of different kinds of hormones that come from the pituitary, but there are 3 major kinds of hormones that actually but when you get an adenoma, a little tumor in your pituitary gland, then it will secrete 3 major kinds of hormones. Not that it can't do more, but those are the typical 3. Okay, hypertension, again, a review on hypertension. Vertigo, I'm going to add vertigo/dizziness, because we need to compare and contrast vertigo and dizziness and find out which one is which, with, you know, whether you're spinning around or the room is spinning around. Meniere's disease is actually very related to vertigo and dizziness, and we'll look at that little trifecta, the little part that makes Meniere's disease, with the 3 different parts that it has to have to be called that. And then there's arrhythmias, which are heart that is just simply going not the right speed. Okay, now starting out with trigeminal neuralgia. Okay, again, it's the trigeminal nerve, as in cranial nerve number 5. They call it tic de la rue. Okay, I don't speak French, but I know that dolor is kind of like the Spanish dolor, D-O-L-O-R, and that means pain. So this is a painful tic, is what they call it. Okay, and why they call it a tic, I'm not exactly sure, other than it does affect, you know, maybe up in here where it can crinkle your forehead and maybe your eyes, and then the other branch of the cranial nerve, number 5, goes down into the face, and then the last part down into the chin here. But out of those all 3 branches of the 5th cranial nerve, it is definitely going to have face problems. Alright, so let's look at some of these signs and symptoms listed here. Extreme burning or shock-like face pain. Okay, extreme, they're not kidding when they say extreme. Another nickname for this is the suicide disease, because they say people that have this trigeminal neuralgia bad enough, they would rather kill themselves than to live with this pain. It is that bad. Okay, so when they talk about extreme burning or face pain, we're talking about extreme pain. Okay, It does tend to be one-sided. In that sense, it acts kind of a lot like a stroke, except that we'll see the difference between what the trigeminal neuralgia affects and what a stroke typically affects as far as different parts of the face. But they are both one-sided because you only tend to have it involved in one excuse me, in one side of the cranial nerve, not bilaterally at the same time usually. Okay? Episodic, they say, as in it comes and goes. It doesn't have to, but the book says it comes and goes. Alrighty? Causes not definite. Okay? Well, there's a lot of causes. Anything, and this is one of those kind of anythings scenarios, anything that presses on that fifth cranial nerve is going to cause trigeminal neuralgia. So you might have a big old fat tumor sitting in the head. You may have a blood vessel that somehow got pressed on, or it expanded and is pressing on that nerve now. You may have anything that sinuses, I mean, for that matter. You could have sinus pressure that is, pressing on one of those branches or on the actual root of the nerve. So there's many different things, and because of that, the actual treatment is going to vary greatly depending on what the problem is in the first place. So certainly there are drugs. When you're talking about these drugs, you're talking pretty some serious drugs. Carbamazepine. Okay, that's really bad. I think that's how you spell it, though. Anyway, carbamazepine, for example, it's a pretty potent drug, and if you take enough of this stuff, yes, it'll kill the pain from your nerve, but you're not really functional either. You start bumping into walls. You certainly shouldn't be driving. Anyway, also depending again how bad it gets, what the problem is, you may have to go in surgery after a tumor. You may have to go in surgery just to cut the stinking nerve. They have a gamma knife that you can cut on that thing, and maybe that's the only option because it's better than, of course, killing yourself. Alrighty, moving on to headaches. This guy has clearly a headache. What is that right there? It looks like he must be some kind of professor. That explains a lot, doesn't it? Okay. Headaches. Alright, let's look at some of these major kinds of headaches. Okay, so we got our sinus headache. That should be pretty straightforward. So if you know where your frontal sinuses are, then it shouldn't be too hard to imagine the headaches, causing if you got your sinuses clogged and your ethmoid sinuses, and you can get headaches because of that. Okay, that makes sense. Pain is usually behind the forehead and or the cheekbones, which are up here. So you get pain somewhere in this area. All right, cluster headache. That's where you get like eye pain. Have you ever had one of those where you get the nasty eye pain? Okay. Tension headache is like, they say it's like a band squeezing a head. So if you take this and you kind of run it all the way around, and then you keep going around to the back of the head back in here, then they say it's like a band that is squeezing that head. And actually, if I remember correctly, it usually starts from the back and works its way forward. But we'll get to that. We'll look at all these in a little more detail. Migraine. Okay, migraine headaches, they do tend to be unilateral, as in on only one side. That certainly doesn't mean that they have to be. But of course, this is the one that everybody knows about. It's incredibly nasty, right? And it causes, not only pain, but it causes nausea and visual changes, and you want to go sit in a dark room and die, basically. But okay. All right, let's look at these. Where are we starting with? Tension headache. Okay, tension headache is from the tension, right? Tension leads to tight muscles. Starts in the back of the head and is band-like around the head. So it's like, or a stress headache. And that's on both sides. So, this is the one where you can feel it coming on in the back of the head and you're like, oh my goodness. Because maybe you got, maybe you got really tight muscles in your shoulders or neck or something like that, and that's causing a tension headache. Okay, you're stressed out, you're crunching up, you're kind of squinching. All right, next one, cluster headache. Severe pain around or behind the eye. Alrighty, so this is your eye. Pretty good eye, isn't it? And you get a lot of pain behind that eye. Alright? It also, because of that, because it has to do with the eye area, you start getting lacrimation or tears coming from the eye. That's my tear. It's not a very good drawing, but, you know, there you have it. Get what you pay for. And runny nose, okay? Because if you remember, around the eyes behind there, you're also going to get some of the, I don't want to say bleed over, but, you know, it's close to the nose, and you get some of the runny nose from that. Anyway, tends to come in groups with the attacks on these, so not really sure what that means, actually. with the cluster of headaches, I mean, you get one, and then it goes away a little while, and you get it again. But usually there's some kind of reason for it, although we'll get into that again in a little more detail. Okay, it's usually unilateral, and it's usually men. Okay, men. Migraine headaches. Okay, here's the part that a lot of people may not be familiar with. Migraine headaches are actually caused by the vasodilation, as in, if this is your blood vessel, it dilates, it gets bigger. Okay, so as it gets bigger, that stretching that comes with it dilating really large is what you're really feeling in a migraine headache. And of course, you know, anybody who's ever familiar with the concept of childbirth understands that you really can't stretch things too much in the body without them hurting quite a bit. Okay, so this is like, you know, giving birth in your brain. That would be bad. Okay, anyway, so that's what you're having. You stretch that, you stretch the nerves, it hurts crazy, like, which I don't really have to tell anybody that. Again, just like the cluster headache, it is usually on one side, and most of the time it is women. So the cluster headaches, men; the migraine headaches, mostly women. In my opinion, this one is worse, right? The migraine. So you get the nausea and vomiting, the photophobia, which means you really want to just sit in a dark room because even the light hurts. Duh, pain. Visual changes. They also have what you'd call an aura. Okay, there's a couple of different kinds of auras. So when you're reading about auras, you can have visual auras, you can have olfactory auras, you can have hearing, auditory auras. So that just, an aura is something that kind of, in a lot of patients, they'll say that they know that a migraine is coming on because they can either hear a buzzing in the back of their head, or they can see like the little halo around lights or something like that, or they hear some kind of, I already said hearing, but, or they smell some kind of smell, okay, some kind of aura lets them know that it is coming on, okay, and hours to, oh my goodness, months, okay, you do not want to have a migraine for months, okay. Obviously, it makes a difference on what kind of headache you have, depending on, you know, the reason. Sometimes it's obviously something very serious, like meningitis. A tumor clearly would cause a headache as it presses on something. A trauma, of course, if you're bleeding in the brain or whatever. A TIA. Anybody remember what a TIA is? A transient ischemic attack, or what else is another word for that? Like a mini stroke, right? Transient ischemic attack, as in you have ischemia transiently. And temporal arteritis. Okay, temporal arteritis we will look at in a little more detail on its own, but of course that can cause a pretty nasty headache. Hypertension. Dehydration certainly can cause a headache. And then you have referred pain, so pain coming from some other place, like maybe the shoulders or something like that because of stress, as we talked about up on the earlier tension headache. Okay, testing, clinical. You get them in the clinic and you try to figure it out. I mean, it's really depends on what the headache is, how old the person is, what kind of history they have. You do some laboratory testing. You might even have to do a CT. Something like a migraine, a lot of times you have to diagnose a migraine by what it's not, and then it's a diagnosis of exclusion of what's left is a migraine. You really don't know why, you're just having migraines. Okay? And of course, just depends. I mean, certainly hormones and things like that can be elevated depending on what kind of cause it is that's causing a headache. Okay, back to our tension headache. Again, now we're looking in a little more detail. So, tension. All right, so what's tension? Well, emotional, anxiety, depression, anger, any of that stuff, right? Poor posture. Okay, so those of you that are sitting there with your poor posture, not that I am any better, but sitting there with your poor posture, that can cause stress on your muscles and cause them to all cramp up. Sitting under poor lighting conditions, maybe that causes you to have bad posture, or maybe it's just because your eyes have to work a little bit harder and that gives you a headache. Arthritis, okay, especially when you're talking about arthritis in your cervical bones, as in your high up in your neck, okay, that would definitely lead to a tension headache. Think about that, you know, inflammation of your cervical bones. I mean, that certainly would hurt. All right, abnormalities in your neck muscles. I don't know exactly who that's referring to, but I'm sure there are people out there, you know, you got your hunchbacks and things like that, right? Anyway, bones or discs. So maybe you got a bone or a disc issue, and that would definitely cause a tension headache as it sends the stress up to your head. Okay, eye strained, we already talked about that, but now maybe one eye is really weak and the other one has to work harder, so that causes a tension headache. Misalignment of teeth or jaws, definitely. So some of that misaligning of your teeth or your jaws, it throws a lot of stress up on those muscles of mastication, right? And next thing you know, if you're stressing out your jaw muscles, and that kind of leads up, and you can feel it up in your temples, and you know, anyway, back of your head, whatever. If it's not all fitting together, then it's certainly going to lead to a tension headache. And then there's noise or lighting, of course, that, you know, anything that stresses you out, anything that's too loud, anything that's too bright, that sort of thing, even too dark. Alrighty, that's a lot of migraine triggers, isn't it? Lack of or too much sleep. Lack of sleep, okay. You might be familiar with that one. Or, of course, too much sleep. You may be familiar with that one too. Okay, so there is a optimal amount of sleep, and if you have too little or too much of it, sure, it could cause a migraine. Skipping meals. Well, I think about the physiology of that one for a second. I can't think of it right offhand, but if it's causing you to vasodilate to make a migraine headache, then how is skipping meals going to increase the width or the diameter of your vascular system? I'm sure if we thought about it long enough, it would make sense. Okay, again, bright lights, just like your tension headaches. Loud noises, just like your tension headaches. Strong odors. Okay, I don't remember that one listed on the tension headache, but there you have at least that. Hormone changes during the menstrual cycle. Okay, estrogen withdrawal headache. Okay, as estrogen levels decrease, then it could actually cause a headache. Okay, stress, same as tension. Anxiety, pretty much same as tension. Or relaxation after stress. Okay, so you can get that rebound effect where you're stressed out and then you get a headache after it's all said and done, and the emergency or whatever it is over. Okay, weather changes causes a headache in some people. And red wine specifically can cause a migraine headache. Okay. Caffeine, that's a big one actually. So caffeine, too much caffeine can cause a headache. or withdraw from caffeine can cause a headache. Okay, why? Because caffeine actually restricts blood flow. Again, if this is your blood vessel and you put caffeine in, and caffeine will go ahead and make it constrict your blood flow, then if you no longer have the caffeine, it's going to rebound the other way, right? And now you're stretching because you don't have the caffeine. So that would be more of a withdrawal thing, okay? If I am not mistaken, if you actually have too much caffeine, it'll actually do the same thing here because it is a stimulant after all. So caffeine can kind of nail you both ways. Nitrates, as in processed meats. I'm trying to remember my nutrition on this, but I think nitrates are found in like lunch meats, turkey, that sort of thing, deli meats. MSG foods, like Chinese food, although it's been a long time since I've been to any kind of Chinese restaurant that actually has MSG anymore, but there you have it, in case they still do. Okay, foods that contain tyramine, which is a what is that considered, an amino acid? And tyramine is in your whole neurotransmitter pathway, where eventually it ends up as dopamine and that sort of thing, and norepinephrine. But anyway, foods that contain tyramine are like aged cheeses, soy products, fava beans of all things, hard sausages, not soft sausages, smoked fish, and Chianti wine, which I have absolutely no idea what that even means. But tyramine is one of those things that there are some conditions, medical conditions, that you would get that you can't take any of these foods because they do contain tyramine. So tyramine, like I said, it is in a neurotransmitter pathway, and because of that, it does have some effects on migraines as well as pharmaceutical medications. Okay, aspartame. I don't know what it is about aspartame, but that gives me a headache every single time I take it, personally. Most people don't seem to notice one or the other, but, you know. Anyway, all of these could trigger a migraine, and you might have your list of some of your own stuff too, but these are the typical ones, they say. Alrighty, let me take a break here for sinusitis, if it lets me. Apparently you can only end on this, you can't take a break. Let's do that then.